It's a very general term, and there's so many things that have antioxidant properties, including medications have antioxidant properties, and people just don't know that. And antioxidants are found in foods, they're found in nutrients, they're found in plant-based chemicals. It's everywhere in nature, so it's something you really cannot escape in reality. And so when the standard oncology community says antioxidants, what they tend to refer to is more supplemental, meaning certain high doses of vitamins, maybe certain herbal type of products or botanical based products, that type of world. And the use of, say, vegetables and juices, even though they have antioxidant properties and maybe even more stronger than vitamins or vitamin C, they don't really tend to put a lot of weight into those ones in general. And when you look at when you really analyze the subject area, you realize there's a lot of holes in it. And what I find quite fascinating is that this subject of combining antioxidants or not with chemotherapy, how it all started was basically a paper written by a naturopathic doctor, which I am, and an oncologist working together. And they just kind of, theoretically was just talking about this subject. And then this paper got a lot of press. It went all over the world 1 billion times, and everyone started quoting it, and this big fear started popping up.
Surrounding the use of antioxidants.
That's correct, along with chemotherapy. And when you really kind of do a systematic review, and I'm talking a very broad, comprehensive review on the subject area, you see that the bulk of the data says doesn't do much for you, doesn't help you or hurt you, or it can actually make you tolerate treatments better, and you can actually do better clinically, with your cancer. So for me, what I did one time is that I started looking at the more aggressive use of antioxidants in chemotherapy. And there's a few published papers using, say, there's one antioxidant called glutathione. It's one that's found in your cells. It's quite a powerful one, and it's actually used a lot to help protect people for certain chemotherapy drugs. They're called the platinum-based chemotherapy drugs, cisplatin, oxaliplatin, which work by inducing a free radical oxidative damage. So I started looking at the data behind that, and I found that, okay, this is an antioxidant that they're given by intravenous injection. They're giving them just before they're receiving chemotherapy. So every chemo they're giving them IV glutathione. And these are ones that have been researched with ovarian cancer, with stomach cancers, and with colon cancers. And you know what all that data showed? It showed that people tolerated chemo better. They can give them more chemo. It didn't interfere with responses, and they had better tolerance throughout chemo. And so when you look at that kind of data, and which is more aggressive, you realize, well, what is a pill going to do? Because the use of chemo is like a big kind of a Hiroshima bomb. And the use of nutrients, I wish they were that strong. I use them every day. What I try to do is not to induce a debate. Patients are stressed enough as it is, and you don't want to put them in a place of being a ping pong. So what I tend to do is I give them the data, I give them papers to read if they want to read them, and I let them make their own decision. And if they feel like, no, I don't really want to combine things with chemo, then fine. Then let's look at, well, you can do them maybe after you're done. You can do them maybe 2 or 3 days apart, maybe, right? There's so many ways to try to incorporate these type of approaches if a patient wants it. And what you also see is oncologists be that way too.
Okay.
What a lot of patients don't know is that all medical oncologists are not the same. Just like if you have 10 mechanics, 10 carpenters, 10 whoever's.
Some car mechanics might say you have to warm up your car, and some other would say, it's all right to just drive
Absolutely.
off.
And that's what patients don't know, is that oncologists are different. So some of them, they may be on the fence. We're not really too sure with this one, We're just watching. Some are on the fence, like, just don't take the stuff on the day of. Maybe wait a couple days after, and then take your natural health products or whichever have you. And others are really conservative, saying, no, we want you to stop everything and do it after it's done. And so, and that's the variability that's out there, and that's what patients don't know. Now, in my experience, because I see a lot of cancer, more so than most, and the naturopathic doctors, I see about 50, 60 cancer patients a week. And I'm in the trenches with patients. I'm in the trenches with them. And I noticed that, patients that incorporate some sort of antioxidant together with chemotherapy or with radiation, that they do better clinically. The same oncologists who have said, don't take anything, and don't do that, and these people started taking things, the same oncologist later says, whatever you're doing, keep doing whatever you're doing. So you see that, and when I see that enough, and I do IVs with my patients enough, these are the ones that, they shouldn't be responding well. They're more advanced cases where they know they're more palliative type of chemo, more palliative type of radiation, and they're seeing them respond and tumor shrinking quite dramatically. You're realizing that this debate, there's a lot more holes in the do not do, and you realize there's a lot more truth in combination type of approaches in general. But again, the bottom line is you present the information to a patient and you let them do their own choice, and then you support them whichever way they want at the end of the day.